Good morning, viewer. Welcome to our FTV. Viewer, a drug. Yeah, a drug can shape the heart and still trouble the muscle. Statins. Statins work by blocking a key step in the body's cholesterol making machinery, primarily in the liver. And that same biochemical pathway, however, also helps cells produce molecules involved in energy balance and normal cellular function too. But some patients interfering with it appears to have consequences for beyond cholesterol. The result can be pain, weakness, or a marked drop in exercise tolerance, and symptoms that are difficult to explain and often even harder to treat. Yeah, they also create a clinical dilemma. The people who benefit most from statins may be the same people forced to reduce their dose or stop taking them. For the same, new research from McMaster University offers a possible explanations for that trade-off. The study suggests that statins can place muscle cells under metabolic stress by disrupting how they generate and use energy, instead of remaining a purely metabolic problem. Viewers, that stress may then activate immune signaling inside the muscle itself, turning a disturbance in energy productions into inflammation and tissue damage. Because statins are among the most effective medications we have for reducing cardiovascular disease risks and preventing early death, said Jonathan Sastrow, professor of McMaster's Department of Biochemistry and Biomedical Sciences and senior author of the study. Unfortunately, muscle side effects lead some people to reduce their dose or stop taking the medications altogether. We wanted to understand why this happens and whether it might be possible to separate the side effects from the benefits. That question matters because statin associated muscle symptoms are estimated to affect 7 to 29% of people who take the drugs. Doctors have long recognized that some patients develop muscle problems, but the chain of events inside the body has been difficult to pin down. And without that map, it has been harder to imagine how to treat the symptoms without weakening the drug's cholesterol lowering effect. We are led by first author Najli Rubin and Nicole Barra of the Starter Lab at McMaster. The researchers studied the problem in muscle cells and mouse models, and this allowed them to follow a damage at the cellular level where the first clues appeared. They found that statins can interfere with how muscle cells generate energy, and that disruption then sets off an immune response inside the cells themselves. So the immune system normally helps defend the body from threats, but when activated in the wrong place or for too long, it can contribute to inflammations and tissue injury. Viewers, when the researchers blocked that immune response in their experiments, much of the muscle damage was prevented, and that result changed the direction of the story. And the side effects did not appear to be an unavoidable consequences of lowering cholesterol. Viewers, one of the most exciting findings of the research is that the mechanism causing muscle side effects appears to be separate from the mechanism that lowers cholesterol, said Sturrow, and that suggests it may one day be possible to target the side effects without interfering with the cardiovascular benefits that make statins so valuable. The study also connects two systems often discussed separately, metabolism and immunity. Changes in the way muscle cells handle energy appear to activate immune signaling within those same cells, offering clear explanations of how inflammations can become part of a drug side effects. The findings are still at an early stage. More research and more research will be needed before they can lead to treatments for patients who struggle with statins tolerance. Still, the pathway identified in the study gives scientists several possible targets for future drug development. Behind this exclusive report.